and other ailments as well, sending us to our GPs, our pharmacists, A&E for help as well. BBC Radio Cumbria's John Bowness, he's embedded himself in a health centre in Carlisle for the morning to basically give us a bit of a snapshot of what it's like at this time of year. Hello, John. Morning. Where are you now then?
Yeah, very good morning again, Mike. Well, I'll give you a clue. Forgive me, I'm going to get a bit highbrow just for a quick moment here. Have you ever heard the phrase, let food be thy medicine and medicine be thy food? Well, I hadn't either before today, but I think we can probably guess what it means. It's just the excuse I needed to pop through the door, just out of the sort of big reception area of the health centre itself and into NJ's Cafe. There's a blackboard up there with loads of delicious things on the menu. It's independent of the health centre, but it's on the same site, and as you can imagine, a lot of its customers are patients here. And cue the sound effect. There, I hope you can hear that, Mike. That's a lovely brew going on and a bit of milk being frothed by the mum and daughter team that run it. That's Joe and Nadia Beattie. Just come across around this side, kind of where my microphone can reach you. But good morning to you both, first of all. Nadia, first of all, I mean, you've been here since January 2023. You've been here nearly 3 years. How's it going as a cafe here on site on the health centre?
Absolutely fantastic. I am so proud of the growth that we have got from customers and NHS staff, and just growing with my mum has been absolutely fantastic. So yeah, that's how I'm feeling at the moment. I'm just nearly feel privileged almost to be here, and yeah, really do enjoy working with my mum. I know it's emotional, but that's how I feel. So yeah.
No, that's really lovely to hear. Whose idea was it to kind of open the place here?
We always wanted to do it together, and then this came up, and we said if we don't do it now, we will maybe never do it. So we decided to take the plunge. Was it hard? Of course it was, but it's been the best thing we've done together.
Absolutely, it was a blank canvas.
John, can you get closer to the
experience of getting a business up and running, so we have learned from the very beginning as well. So yeah.
And why choose a medical centre in particular? You know, there's lots of places you could open a cafe. Why one here?
So this was Locke. So I was previously a restaurant manager at a restaurant called Locke. Absolutely amazing Pan-Asian Japanese cuisine. So we was serving a customer, and she said, "Oh, my dad." She asked what my dream was, and she said, "Oh, well, my dad's best friend is opening a medical centre in Harrowby, and they want a cafe." And I said, "Are you joking? No way." So then we had an interview with them like a couple of days after, and they seen our passion and they said, "We don't want anyone else, it's yours." And then we just went from there. So that's how we got here. Yeah, we went, and then they said, "We're not going to bother with anyone else. We want you to run this cafe in the medical centre." Yeah. So that's how our journey began. So.
It was ours right from the beginning. So the drive home to Wickerton, it's like, oh, we're really doing this.
Yeah. We got it.
And Joe, it's not just the patients that you care for here or that you serve here. You know, you've got staff coming in, nurses and so on. You know, all sorts of people.
A lot of customers as well come in because they were at the medical centre, and then they come in again and again, so they use the front door now. Because you say to them, "Come again," and they say, "We don't want to go to the doctors." "No, but you can come here and you're not going to the doctors."
Yes, I should make the point, just behind me you've got the glass doors straight out onto the outside of the building, so you've got your own independent, you know, entrance into the cafe here.
Lots of repeat customers, lots and lots of repeat, and they're friends now as well. Very much friend.
Coming to a doctor can be, obviously it's a great relief to some people, but can be a stressful time depending on, you know, the news that you're being given or the, you know, the treatment that you might be going to have. Do you find yourselves having to sort of, you know, look after your customers a bit, maybe almost put an arm around a shoulder now and again?
100%. We're a little hub community as well when people come in. So if they're talking and, you know, someone's feeling down, you want to put a smile on someone's face by the time they leave the doors, and that's literally what we love. And you just feel like you get a real closeness of the people that come in, and the support we get week after week. Like, we get regulars that come in every week, and we're just absolutely grateful for that. So.
We have a lot of couples who come in, and obviously some of them are elderly, and then you notice maybe one health declining, and then you feel there's a sense of you just feel close to them because of situations they're going through. And if you can't listen to people, goodness me, and be there, I'm the hugger. There's nothing. I mean, we're both Northern Irish background, so warmth is very much a big thing for us. And obviously the food speaks for itself too.
Well, I was going to say, it's piled high on the counter in front of you here, under lots of sort of glass cloches. There's scones there, and there's cakes, and there's all kinds of things. I'm thinking, I mean, my last healthcare assessment was yesterday, well, other than what I've just had live on air this morning, and I'm kind of at the top end of the safe weight limit, so I kind of need to do something about it, but it's so tempting seeing cakes and so on. I mean, do you ever get people coming in and kind of feeling a bit guilty that they're going to indulge even though they're here at the doctor's?
We also have other things that they could come, and we always say whatever day they come in, there's not many calories on that day. So they're fine. Moderation. I cooked for children for a long time at a school previous to this, and moderation. Come on. Yeah.
And what's it like? I mean, you sort of touched on it at the start, but what's it like working as a mother and daughter team? You know, seeing a lot of each other the whole time and working together constantly.
We have in the 3 years, well, almost 3 years, so that'll be January the 23rd, will be our 3rd year. We have not had a single argument. We're too alike, we get on. We've got more of a mother-daughter / friendship relationship, so we can have a crack, we can have a laugh.
Mini-me.
Yes.
My mini-me. My little mini-me.
Yeah. So we're quite similar. We just work really well together. And the inspiration for ideas when stuff's on, because yes, we've got the tray bakes and scones, but we've got soups, salad bowls, all our paninis, toasties, sandwich fillings are all fresh. And we're always bouncing off each other to new ideas that we've got on throughout as well.
We love food.
We love food. And that really helps as well. We do really love food. So yeah.
It certainly helps anyone running a cafe if you love food.
We don't see each other at weekends though.
No.
Well, look, thanks both for talking to me this morning. So Joe and Nadia Beattie, good on you, and I wish that I could send some of this amazing food kind of down the microphone so it would appear in the studio for Mike, who's
and don't forget to eat your mince pie. Don't forget to eat your mince pie.
No, there's a coffee waiting for me over there on the table when I get 5 minutes with a tiny mince pie on the saucer, so thank you both very much. As I'm discovering, Mike, health centres are not just about GPs anymore. There's cafe, there's healthcare assistants, there's all sorts of other people like physiotherapists and paramedics, and a lot of other healthcare workers, and I'm going to be hearing from some of them in the course of the rest of the programme today and in the course of the rest of the morning on BBC Radio Cumbria with Steph after 10 o'clock.
OK, John, thank you. There'll be more with Steph Finnan from John Bowness, who's out and about today after 10, as John was saying.